pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, I want to welcome everyone to the May 6th Health and Human Services meeting. We have an agenda in front of you. What is your pleasure? All in favor, please say aye.
Aye.
Any opposed? All right, you have the minutes of March 4th, because we did not meet in April. What is your pleasure?
Support.
All in favor, please say aye.
Aye.
Any opposed? That brings us to our first limited public comment. Anyone in the gallery wish to address the board that's not on the agenda? Feel free to come on up. Okay. That brings us to Martha. You are up first. Health and Rehabilitation Services Semi-Annual Report.
Morning,
Morning.
everyone.
Claudine, did her stuff not get in there? Martha's. Is that on, Jane?
Take it away, Martha.
Okay, we're going to start with financial commentary. So there's two documents, well, technically four, front and back, that I prepared. So for financial commentary, we had another strong month. We've actually had a very strong year. Our occupancy numbers are holding strong. We're starting to show some profitability. So non-operating income is $113,000 month to date and a little over $93,000 year to date. Overall net income performance is $188,000, a little over that month to date, and a little over $621,000 year to date. March includes payments of the first 6 months of the county capital contribution of $75,000, which does help bolster cash for future capital needs. Current cash balance as of 3/31 is just over $4 million, which is a slight increase of 1.4% from prior month. So much of that is the settlement activity that I've been discussing with the board over the years. We're starting to receive that in. We actually received that in. We will have to repay roughly $1.7 million because we received an advance. Most nursing homes did because we were all struggling with cash flow. So we are still expecting $3.2 million to come in. So the net between the 3.2 and the 1.7 is left right around $1.5 million, which will also help cash flow. Month-to-date expense per resident day is sitting right around $481.52, which is a slight decrease of less than $5 from the prior month. Revenue is higher than the month-to-date expense of $511.33, which is why we're showing revenues over expenditures. Overall, month-to-date net income per resident per day is just around $29.81, which is an increase of $4.71. If you recall, in prior months, I was discussing how expenses were exceeding our revenue. So we've been able to really look at expenses, review expenses, and the other thing that's really supporting operations is our occupancy. So for us, and I think for most nursing homes, 90% is that goal. So if you can hit 90% and above in a nursing home, generally you're going to see revenues over expenditures. And as you know, we've had the unit offline, we've had workforce issues, our census has been historically since COVID, through COVID, in the 80th percentile, which is very low. Historically, we've always been at 98 or 99%. That's why we've performed so well. So we're starting to see that increase again, which is very helpful. Some of that is related to because our CNA and nurses workforce is stabilized. So as they've stabilized, we've been able to increase some of our open rooms. Previously, we couldn't do that if we didn't have enough staff. We couldn't care for the residents. So that's a huge positive. We did open our palliative hospice wing with the bed that was offline. It's kind of a hybrid unit. It's currently sitting at 24 beds. We're running half of the unit as a palliative hospice unit, and we've been occupying probably 3 to 4 beds per day. The other side, we're getting ready to reopen as long-term care because we're seeing a need and an increase in referrals, and with staffing, we think that we can fill it. So if we can continue on that trajectory that we will continue to see revenue over expenditures. Now, the cash flow is a little deceiving because I think I've talked before about how we have deferred maintenance. It sounds strange to say to all of you, but the building is aging, right? We built the new building in 2003, so 20 years later, all of our rooftop units are starting to age and we need to replace those, and those are very costly. We're seeing our fire suppression system needs to be updated. We have some capital needs for nursing that we have to really address this year. So the goal is really addressing those needs this year and into next year and replacing some of those rooftop units. So the cash is really going to decrease as we really address those building needs, which will be at least $2 million. So, but we're phasing that in over the next couple of years. Let's see, just to update you on regulation, CMS did release a new minimum staffing ratio that all nursing homes across the United States must be in compliant with. They are phasing it in over 2 to 5 years. Thankfully, we are already above what they're going to require, excluding an RN ratio. We do have a high ratio of RNs, but we're not quite to where they expect all nursing homes to be. And quite frankly, I don't think there's any nursing home that's going to get to that level. There just isn't enough RNs to go around, and most RNs really, once they start as an LPN and are working in a nursing home, transition to a hospital. So that regulation is going to be tough for many, many nursing homes. And that being said, I think the for-profits are also going to struggle with the CENA minimum staffing ratio. It's going to really increase their expenses, and I think we're probably going to see several nursing homes that are going to close over the next couple of years because they won't be able to hit their margins. I did include on the back of one of the slides kind of our market analysis. We are a 5-star. We've continued to remain a 5-star. So I just placed that on there so all of you can see how well we're performing and we continue to perform. And I think that's certainly related to the staff that work at the facility. Lastly, just to share, we have engaged with Plant and Moran to complete an operational assessment. So they're really going to drill down, well, they have already started to drill down and look at all of our service lines and provide an overview to the board and to this board of how we're performing per service line. Because I know there was a question previously, so I wanted to make sure that we presented that information to this committee. Are there questions?
Questions for Martha? Yes, Jeannie.
You're going to different meetings than I am, but I'm still concerned because I see that over time, we're hitting the big surge of the people 65 and over, the early boomers. And they figure there's 30 million coming within the next 5 years into that category. So you just talked about the changes in the staffing levels, and that may interfere with being able to keep all these nursing homes open. But of course, the nursing homes that are open, a lot of them take, as we talked years ago, the one down the road here being built was for profit. And then when they run out of the money, then they come get on your waiting list.
That's right.
So that hasn't changed in 15 years.
No.
So my concern is you got all these people that they really know are coming, into those age groups. And we're having a really hard time also, with staffing the caregivers that come out to people's homes and things like that to keep them in there. Is anybody talking at the government? What are you going to do with all these people that you actually knew were coming since I was in kindergarten?
I think what they are talking about is healthcare workers and how can they attract healthcare workers and create career ladders, and looking at using some of the funding at the state level and federal level to support that. I'll give an example. Recently, the state approved a career ladder for CNAs. So on-the-job training CNAs, which really has been unheard of. So in our environment, a nursing home environment, if a CNA wants to become an LPN, we can enroll in this program, apply for a grant, and they will pay for the CNA to have on-the-job training and then to attend college while they're working for us. And it would have some cost for us, because the goal of the program is to work with them with their classes and still pay them. So it's on-the-job training, they receive their wages, and they're still attending their program so they can still pay their family. So I think that will pay off eventually, but they're just starting it now. And without future healthcare workers, it will be impossible to take care of more seniors in the community. So they are starting to focus on it now so that we can really attract and develop those career ladders.
Joe?
30 million people is a lot of people.
It is, and I think as nursing homes close because of profitability, the question is, where do they go? And I think the government solution has been, historically, they would like them to stay home. And we just know that that's just not possible for everyone. We want them. That's why we have rehab. 90+% of our patients in rehab go home and recover and do well, but not everybody does.
Joe?
So now you project, though, that we're going to have that 90% capacity, 90% of the beds filled going forward?
Yes, I can't say how soon we're starting to work on that now, and so a few beds at a time. But based on what we know is coming in future years, we can forecast that potentially we'll be back to our 99% occupancy. So now, that being said, we still have those increases from COVID, those 30% increases that we're still, trying to get our arms around. Those staffing wages increased dramatically. There are some positions that are still probably not where they need to be because the government really focused on the CNA and the nurses. They just started focusing on housekeeping, dietary, and activities. No increases for administration. They haven't had raises in several years. So it is challenging, as we also see people leave our organization as we've struggled with increases because we just haven't had the funds. So,
Okay, thank you, Martha.
sure.
Joe?
Well, I guess that's where I was going to go. Your report today is encouraging. I know some of our discussions previously were that you were looking at a financial cliff that you were going to be off in the next 2-3 years. Have you been able to do any long-range forecast as to where your situation's going to be in the next 2-3 years? Are we looking at still some necessary assistance, or do we think that we might be able to climb out on your own?
I think we'll still need some assistance because the cash that we have is going to be spent on the building, and I can forecast that the census is going to increase to 98% because of the boomers that are coming, but that's still probably 5 to 8 years out, so there's going to be a gap. So I do anticipate that there's going to be a need for the organization, because I know we look at this cash and it's deceiving. We see it, it's great, it's wonderful, but quite honestly, most of it's already spent with what is needed in the building.
Do you have any sense at this point as to how much you may be, and we really don't have to get into the weeds today, but are your forecasts to the extent that where you may have some idea of what the need would be?
We're reworking some of that forecast. I would say we're still going to be, we were forecasting, 2 million, 2.5 million. I'm still going to forecast that gap few years between that 1 and 2.5 million. So we're trying to narrow that down. Also looking at our expenses and trying to control them and rework anything that we can. And we've been able to do a little bit of that. That's why we've seen our expenses decrease per day. But I can't say that will continue. There's certainly, as I said, some wages we need to look at and some other positions that have remained open that we haven't filled.
Well, you touched on it just briefly. Most of what I've read recently is that there's an awful lot of the people my age and around my age who want to stay home. And that seems to be where the push or the interest is on part of the government to do whatever they can to assist people who can stay home. Do you have still a waiting list? Do you have people that are looking to go into facilities like yours at this point?
We did, and then COVID hit, and then that list kind of, weaned away, but it's starting to build again, and that's why I'm confident that our wing that's been offline, we can reopen it, because we're receiving more and more calls, and the waiting list is growing again, which is very promising. And I think when we look at the statistics, with 30 million seniors coming, even if a small percentage of them are not successful at home, that's those that need nursing home care, and that's a huge number.
No, that's true. Although both you and Jeannie have referenced that the 30 million are coming. I think the 30 million are already here. I mean,
Yeah. I do think it started, but it's going to, the wave is going to increase. It's going to get much larger.
all right, thank you.
Sure. Other questions?
Chairman Mon.
You referenced, if I remember right, you got to have a certain amount of RNs or per patient or per person. What's that number?
Oh, off the top of my head, I'll have to get that to you.
That's okay.
What I can tell you, it's increasing to 0.5 per patient per day, which sounds very low, but the expectation is you'll have an RN on site 24/7, 7 days a week. Right now, we have RNs that are in the building. I think we have one day that we may be missing, but we have RNs that are on call and come on site. So that's changing because they'll have to be on site.
Is that rule set by the state as far as the number?
It's the federal government.
Federal.
So they've been talking about it and discussing it in legislature for probably, I'd say, 3 years, and it was just finalized several weeks ago. And their implementation period, it begins actually immediately for our facility assessment. How our assessment tells us how we're going to prepare for this in the future. All nursing homes have to do that. And then they phase it in over 2, 3, and 4 years. They phase in so they can see that we're going to be in compliance. We mean nursing homes in compliance by that 4-year mark.
Okay. Yeah, I was just wondering because of the disparity in the amount of people going into nursing homes and the lack of RNs and help, that if they're going to take a look at that, so.
Yeah, most nursing homes staff with LPNs, the majority of them, and not all LPNs choose to go on and obtain their RN. I think what we're going to see, and there is another program that's getting ready to be reviewed and approved for LPNs to move up to their RN and also do it on the job and to be paid on the job and attend those classes to matriculate to an RN. So that will be successful as well. But once again, I think what we're still going to see, unless there's a drastic change in wages from the RN in a nursing home and the RN in a hospital, the RNs are going to, as they always have, they're going to leave for the hospital because the wages are just very different. They're compensated much more in a hospital.
Yeah, makes sense.
Anything else? Yep, go ahead, Jeannie.
I remember like 10, 12 years ago, they had a big push to have all the hospitals staffed with RN level and bachelor's level. And so it really dwindled the amount of people who became LPNs. You know what I mean? So they can't, the thing is, until they adjust at the hospital level to going back to at some point using LPNs to do certain tasks, it's still going to keep our people going into the nursing field at a lower level than what the need is going to outpace it. Does that make sense? Because I knew somebody who worked at the Michigan Association of LPNs, and they ended up closing that because of the reduction in people going to the LPN level. And so I think it's good that they're bringing back the LPNs, but I just see the staffing shortage just coming, you know what I mean? I'm sure you can see it too, sitting at your own conference table.
Yeah, it definitely is. I think, what I think is hopeful, what I see in my workforce over the 20-plus years I've been there, I see more and more CNAs that are completing their prereqs, that are enrolling in the nursing program. Today, I think I probably have about 14 CNAs that are working on their nursing program, either in their prereqs, so that's pretty significant. Many years ago, we just didn't see that, but we are seeing it. The other thing is, other states are kind of ahead of us, and I'm not advocating either way. I think LPNs are wonderful, and they do a wonderful job in our organization and are very skilled and talented. But other states have really gone away from LPNs. They no longer exist. They don't license them. If you want to become a nurse, you have to become an RN, and then you can advance to a BSN. So some states are ahead of us in this. So this federal rule that they've enacted, there are some states that are going to be ahead of us because they already decided a year or 2 years ago that the LPN program would no longer exist in their state.
And on when you say that you still have one wing down, you had two before, if I'm not correctly.
Yeah, so it's one neighborhood
Okay.
has 50 beds, and so we refer to two wings on one neighborhood.
Okay, so are you saying that there's one neighborhood still down?
There's one wing. The other wing we opened as palliative hospice, and right now occupancy is averaging between 2 and 4 per day, residents per day.
Okay, so that's how you did that one. Okay, thank you.
Sure.
Very good. Anything else for Martha? Thank you so much for your report. Anything else you have for us?
No, thank you.
Very good. Thanks for coming in. All right, Tri-County on Aging. Hey. Good morning.
Good morning. Kate Long is going to present the report, but I just wanted to take a minute to introduce myself as the Executive Director of Tri-County Office on Aging, and wanted to take a minute to thank our appointed board members, Jeannie, Blake, and Mark, for their participation and attendance at our events. So thank you. Thanks, Andrea, and good morning.
Morning.
In here. So, as a general update, TCOA will have continued to have a staff presence on the Eaton Vulnerable Adult Network and Eaton Human Services Collaborative Council meetings. 3 staff from the TCOA attended the U.S. Aging Policy Briefing in March in Washington, D.C. This was an opportunity to get the latest breaking news in aging policy developments and to meet with representatives and senators in Washington. The TCOA Advisory Council appoints representatives to serve as delegates to the Michigan Senior Advocates Council. Thank you to Paula Jensen, Eaton County resident, and Sue Hoffman, Eaton County resident and Advisory Council member, for their involvement on the council. As TCOA is in part funded by the Bureau of Aging, Community Living and Supports, or ACLS Bureau, TCOA must operate under an annual plan to ensure compliance with the Older Americans Act. The 2025 Annual Implementation Plan draft is available on our website at tcoa.org/documents. A public hearing will be hosted actually this Thursday, May 9th, at TCOA and on Microsoft Teams. Following that, local units of government will have the opportunity to provide feedback by July 21st, but more information will follow. Older Michiganians Day took place last week on May 1st on the Capitol lawn. This was a day of advocacy on issues that impact older adults and caregivers. Over 300 people gathered to hear from members of the legislature and advocates from the Aging Network, with many more watching the live stream online. Thousands of letters were submitted to legislators from constituents across the state supporting the 2024 platform items, including 350 letters from our region alone. The TCOA Advisory Council acts in an advisory capacity to the consortium board. Thank you to Sue Hoffman, MSAC representative, who represents Eaton County. We do have one vacancy on the council at this time, so any recommendations can be sent to Casey Cooper at cooperc@tcoa.org. TCOA is a partner with the ADRC Capital Area Partnership, offering information and assistance and options counseling to the community. Currently, the Long-Term Care Collaborative continues to gather information to better understand how homelessness and other housing issues are experienced in our communities in order to identify future projects for the group. Moving forward, the data that I'll share will reflect the period of October 2022 through September 2023, unless I mention otherwise. For information and assistance, 13.5% of information and assistance callers were from Eaton County. TCOA also contracts with Capital Area Community Services for additional support in the Tri-County area, and CACS assisted 307 callers from Eaton County, which represents 13% of their total callers. For Community Resource Navigators, TCOA's 2 Community Resource Navigators served 21 people, with 10% of that from Eaton County. Friendly Reassurance, TCOA launched the Friendly Reassurance program in April 2020 to connect volunteer callers with TCOA participants facing social isolation. But as the program continues to experience a natural wind down, TCOA is going to work with current volunteers and participants to wrap up the formal program. Of note, though, is the Retired Senior Volunteer Program, or RSVP, offers friendly reassurance to older adults throughout Clinton, Eaton, and Ingham counties and is a referral partner for TCOA. For nutrition, TCOA served almost 44,000 meals to 368 Eaton County participants through the Home Delivered Meals Program. Due to the sustained high demand for meals in Eaton County without additional funding to support it, a wait list was implemented in February of 2024. There are currently 12 people waiting. TCOA has served more than 1,100 meals to 16 Eaton County residents through the Congregate Senior Dining Program. We continue to work toward reopening the Grand Ledge dining site. The biggest barrier has been volunteer recruitment for that. So we're open to suggestions as far as that goes. We're also considering offering a breakfast meal at the Grand Ledge site as a way to entice people to come to that location. For disease prevention, health promotion, TCOA is primarily offering health and wellness workshops in person, but we are still offering workshops online as well. And we have a schedule on our website, including new offerings such as Dementia Caregiver Series and Walk with Ease. A total of 27 Eaton County residents enrolled in an evidence-based health and wellness workshop. For Medicare Medicaid Assistance Program, or MAP, MAP volunteers provided Medicare and Medicaid counseling to 170 Eaton County beneficiaries. For Project Choices, 27% of those served through My Choice, Medicaid waiver, care management, and case coordination were from Eaton County. An additional 182 Eaton County residents are waiting for these services. Volunteer opportunities. The need for volunteers agency-wide, particularly Meals on Wheels delivery drivers, is ongoing. Anyone interested in volunteering is welcome to contact TCOA's Volunteer and Outreach Specialist. To fill out a volunteer application, you can visit our website at tcoa.org/volunteer. We also have a few events coming up. We have our annual Meals on Wheels golf outing on June 11th at Forest Acres. We also have our annual dinner and auction on November 21st at the Kellogg Center. And also important to note, 2024 is TCOA's 50th anniversary. So we have some planning efforts underway, and we will definitely share more information once we have that available.
Awesome.
Any questions?
Question? Jeannie, you got the third look.
Okay, so thank you for coming, Kate. We've had conversations at our board meeting about needing volunteers to do the Meals on Wheels. And I do notice in your report here how low the participation is at the actual dining sites. So, are people being told if they call and want a Meal on Wheels? Because in Eaton County now, you're right, I do know some people have called me and said, do you know that I can't get Meals on Wheels for my mom? I'm going, yeah, we're short of volunteers. And but some of the people that are wanting to have their meals delivered, if they call, do we tell them to go to the dining sites and they can at least pick them up if they don't want to eat there?
I would encourage, because it is a demand issue as well. It's not just volunteers. So that's why the wait list is what it is. But I would say just to call and talk to the nutrition program and have them discuss with that participant what their needs are and what might be the best fit for them, depending on their situation. Because we're very person-centered, so we want to make sure that the individual is being served in the way that they prefer and also in a way that they can manage.
I'm just concerned, I mean, what was in our report, 17 come to the dining sites? It's not very high. I mean, it's like popped out.
16, yep.
Okay, so my point is, we're just, I mean, 16 people in the size of that community room over there at Brenton School, it's just not a lot of people.
Right.
So,
That's also why we're looking at opening the Grand Ledge dining site to try and attract more Eaton County residents and have another offering in the county.
so, yeah, but you need volunteers. I don't
That
see
too.
the volunteers are coming. I mean, from anybody. It doesn't make any difference what I hear from general people who need volunteers too. I know that I ended up doing the tax site as a volunteer all the way through April 15th this year because the VITA sites didn't have enough volunteers. I mean, I started doing it just in February by last year, in 2012. This is the difference in your volunteers. Last year, they were short at the VITA site, so I worked in March. Then this year, there's nobody coming, so I did it all the way to April 15th. And I did a nonprofit for 11 and a half years, and part of that's why I left, because I just couldn't recruit the volunteers, and I don't know why.
It has been difficult. It's been particularly difficult post-COVID. Some people have had to return to work or their interests have just changed. But we have to get creative because we need them to operate our program.
Yeah, we do. So, I mean, that's why I'm asking you if we encourage people who are calling and, wanting their meals for their mom delivered on the front porch. Could they even drive mom?
There is the carry-out meal option, so that is an option. But again, I would call and talk to the nutrition program to make sure that that's available and would fit their needs.
I mean, because a couple of these people are retired that could go pick up mom, take them to the dining site and at least pick up the carry-out.
That would be helpful.
You know what, I'm saying, you're saying creative. I'm being creative here.
Yeah.
Might not be what you want to hear, but,
We appreciate all ideas.
so.
Anything else for Kate? Thank you so much for your report.
Thank you.
All right, Mid-State Health Network. Good morning.
Good morning. My name is Amanda Ittner. I'm the Deputy Director at Mid-State Health Network. If you're not familiar with us, we are one of 10 PHPs in the state of Michigan. So that is a prepaid inpatient health plan that manages the Medicaid benefit through a contract with MDHHS. We do that through 12 community mental health agencies throughout our 21-county region and over around 80 to 100 SUD providers for all 21 counties. So in your packet today, I believe you have the intergovernmental agreement. Part of our requirements with MDHHS is to create a substance abuse oversight policy board, and that is a 21-member board. There is one member appointed from each one of our counties. Kim Thallison is your appointee for Eaton County. Part of that board makeup is also an agreement with all of the 21 counties, and that is to manage the funds for liquor tax funds, and those are your funds that you receive from Treasury, and 40% of that actually goes to Mid-State Health Network to manage the substance abuse benefit related to those funds. We are required to spend those funds in the community where it was earned, so those dollars from Eaton County are spent on Eaton County individuals. We are not allowed to spend any of those funds on administration. And then we report out through that 21 county board on expenditures, as well as our overall general budget that includes both behavioral health services as well as block grant, and any other local funding sources that may be used. So the intergovernmental agreement is a 3-year agreement. I believe this is the third time now since 2014 that we've renewed this agreement. There are 3 changes noted in this year's agreement. One is the term, just to make it consistent with the bylaws that we have operated under. 2, we updated the anti-discrimination language to be current with current laws. And then 3, we added an alternate. During COVID, as you probably experienced too, we had a hard time meeting in person. And so while there's always been that option to appoint an alternate, we now allow for the alternate to vote if the appointee is unable to attend. And so those were the 3 minor changes to the agreement. We are looking for Eaton County to sign and return the agreement. Once we have all 21 counties signed, you will receive an executed copy. I can take any questions.
Questions? Joe?
This, I think Amanda indicated this is the third time with this particular PHP organization. What she didn't mention is that they are also the coordinating agency for the various counties. And that's a separate function, and that's why she's here today. The coordinating agencies have existed since before I came on the board, and I've been a member of the coordinating agency boards off and on for the last 30-odd years. So we basically have 2 choices. We can, and in the old days, it was 50-50, now it's 60-40 split. We could keep the 40%, but we would have to initiate the programs ourselves and run the programs. Or we can go through the coordinating agency, which is for the last, almost 10 years has been Mid-State with the 40% now. It's always been financially, frankly, not appropriate for us. We've looked at in the past, hanging on to the money. It's not workable. And so it really is to our best interests to continue to work with Mid-State as the coordinating agency for those funds. They are segregated. They are used strictly for Eaton County. And so I would suggest that we approve this contract.
I'll take that as a motion. Any, there we go, and support. Any further discussion on renewing our contract with the 3 amendments with Mid-State? Seeing none, all in favor, please say aye. Aye. Any opposed? Very good. Anything you'd like to add?
No, thank
All
you for your
right.
time today.
Thank you.
Wait, well,
Oh, what? I apologize. Go ahead.
what,
Based on the way we have it in the budget right now, we do not have it allocated, so when we receive a bill, we're still only getting the 50%. So I'd like a motion from this committee to include in the budget the 50-50 split.
50/50?
Or sorry, 60-40 split, so that they're receiving the 60%.
So moved.
Support.
Just for my point of clarification, is this an amendment to the previous motion or a separate motion?
Separate,
Okay.
and that it'll go to the budget, so we'll make that a budget
Go on to
amendment.
Ways and Means, okay. All right, any discussion or clarification needed? All in favor, please say aye.
Aye.
Any opposed? All right, very good.
Sure.
Thank you. All right, we are on to strategic plan.
I just want to give everybody a quick update on the opioid work group activities that have been going on. So the MSU survey has now closed, and MSU is working on their final report for the needs assessment. The work group has met with Amy Dolinky from MAC. She's assisting us with this program, and she will be using the data from MSU along with the data from the health department to come up with a recommendations report for the plan. She's going to start working on that. And then the opioid work group did meet last week, and they started discussing next steps for moving forward once the plan is complete late summer. So that is what has been going on with the opioid stuff. If you have any questions, please let Chair Ma or a committee member or myself know.
I also have one more update. Our legal counsel dealing with all of the lawsuits has entered into another based on pharmacy benefit managers. So they're going say, going after them. It's the same as what happened with our insulin legal action, so I signed off on that.
Very good. Any other miscellaneous?
No.
All right. That brings us to our last limited public comment. Everybody was here in such official roles. Anybody wish to just speak as the public? All right. We stand adjourned. Thank you, everybody.